Hello and welcome to Represent NYC on the Manhattan Neighborhood Network. My name is Victoria Bert. I'm the producer of this show. Joining us now is a guest that we've had on many times before, and his name is Mark Levine, City Council member who represents District 7 in New York City. That is the neighborhoods of Morningside Heights, West Harlem, Washington Heights, and parts of the Upper West Side. How are you today, Mark?
I'm fine. It's great to see you, Victoria.
It's good to see you too. So there's a couple of things that we're going to talk about. The first thing I want to ask you about is based on a tweet that I saw you send out about the census, and that we're at 53%. Is that correct? And what are your concerns?
This is cause for a red alert in New York City. We are so far behind where we need to be. We are far behind other parts of the country in census completion. And the impact of this could mean loss of political power. There could be a congressional seat on the line here, and loss of billions in dollars of funding, which is apportioned based on population. And that's, of course, confirmed by the census. So as tough as it is now in the midst of a pandemic and all the other challenges we have, we need everybody to fill it out. It takes 10 minutes. It's 10 questions. There's nothing intrusive about your immigration status, about your income. Doesn't ask for your social security number. It's safe and secure. It can be done online. And we want everyone to step up and do this now so New York is counted, so we get our share of power and resources in the decade to come.
I mean, that's the fear a lot of people have, right? That it's going to be asking them things that make them uncomfortable or make them unsafe. Right, if they're undocumented.
President Trump deliberately attempted to sow fear among immigrants by proposing that a question about immigration status or citizenship status be included on the census. Now, the courts thankfully struck that down, but I think there was real damage done because of immigrants understandably worried that they would be exposed in some way. But in fact, census data is secure. It's actually a federal crime for a census taker to reveal personal information. Again, there is no question about citizenship or documentation status on the census. So it is safe and secure and extremely important that everyone participate.
Okay, so I'm going to switch gears now a little bit. I recently responded to a tweet of yours about how long it took for the COVID-19 test to come back after taking a nasal swab and an antibodies blood test. Mine took 14 days.
Outrageous.
Tell me what's going on. Why? I know I had no symptoms and I had little contact a very long time ago with somebody who was infected with COVID-19. So I wasn't obviously in the rush department, right? I wasn't having surgery or dental work or anything like that. But at what point is the test become invalid if the results are 2 weeks later?
Well, it's pointless if a test takes 2 weeks. Honestly, if a test takes 1 week, what you're risking is that someone who's contagious will be out walking around, potentially spreading the virus, not knowing that they are positive. You need rapid results for contact tracing, to protect schools, to slow the spread. And what we've got now is an epic national failure, still 5 months into this pandemic, to solve this problem. There's simply a shortage of all the resources for labs, from equipment to reagents, to the chemicals you need to run the machines, to basic supplies. And it's created backlogs at all the national labs. And it is a national problem because labs that service New York also service Florida and Texas and places in the country which are surging right now. And this can only be solved by the federal government. They need to activate what's known as the Defense Production Act to mobilize production of all the shortage equipment and materials to solve the supply chain problems, to solve the lab capacity problems. But in the meantime, New York City is also going to have to change the way it's managing this. We have really since June just told everybody to get a test, everybody, no matter who you are, no matter what your situation is. And we've been particularly running these through City MD, which has a special agreement with the city, which is testing everybody who walks in, even if they're not walking in for a test. They could be walking in for another medical issue or walking in for an antibody test, which is a whole different test from the kind that you got and what we're talking about, which is a test to diagnose whether you have the virus currently. And that's just clogging up the system. And it's also creating real inequities. In neighborhoods, wealthier, whiter neighborhoods, the testing rates are much higher and the positivity rates are much lower, well under 1% of the tests are coming back in positive in wealthier zip codes. But in poor areas, including Uptown Manhattan and including places like the Central Bronx, Southeast Queens, testing rates are much lower and the positivity rates are much higher, as much as 15%. So we're going to have to reorient our testing and really focus on the people who are highest at risk. Those who have symptoms, those who have been exposed to someone who's been confirmed to have the virus, essential workers who, because of their work, are in contact with the public, and of course, people in settings like nursing homes where we know the risk is high. But we're going to have to pull back from some of the really broad testing efforts until the turnaround can be returned to something reasonable like 24 or 48 hours.
Why was that the initial call to action? Everybody get tested.
I think we've measured our success on testing in New York City by one number, the number of people getting tested a day. City MD is in over 100 locations in all 5 boroughs, and it was a great way to pump up that number. But that really shouldn't be our measure of success. We have to test the right people, and we have to turn around results in a timely fashion. So we'd be better off testing fewer people, but having a shorter turnaround. That would be more useful to the people who need answers. It'd be more useful to our public health fight. And that's going to require a change of strategy here, and certainly something I'm calling for.
You talked about the inequality, like access to testing that people are running into.
Absolutely. Again, the main provider in the city is one which is not designed to welcome uninsured people, and we're testing very few uninsured people. The city health department did something great last week. They went into a low-income neighborhood and actually in the Bronx and Tremont, and they set up a mobile unit with one of these new expensive machines that has a rapid test result in 1 hour. They did tons of outreach in the local community. Hundreds of people came in for tests. They also found a lot of positives, which indicates that there's a huge need that was being unmet.
Yes.
And that's the kind of strategy we need. We need it in places like Harlem and Washington Heights, East Harlem, Hamilton Heights, where testing rates are lower and where positivity rates are higher. But you have to go to people. You have to work with local CBOs, faith-based institutions. You need social services. What they did at this, again, in this great project in the Bronx, they had services ready on site. If you test positive, immediately they can work out with you. Do you have a way to isolate? Do you have a way to quarantine? Right. Do you need food delivered to you if you're quarantining? I mean, let's not forget why we need to test. We have to stop the chain of transmission. If people test positive, they have to quarantine.
Right.
And that isn't like sheltering at home where you can still go out to the supermarket and the pharmacy and do some of your normal life. No, you really have to be at home, period, other than a medical necessity. Right. But what do you do about food? What do you do about laundry? What do you do about pharmacy? What do you do about walking your dog? I mean, all those things the city has to take care of, or else people who are contagious are going to be out in the community spreading the virus. So we need those kinds of intensive services. And, there's something great the city's offering, which almost no one's taking the city up on, which is hotel rooms for free for people who are positive, who are at risk of spreading the virus to people in their home. In Manhattan, we live in crowded apartments. It's just a reality. And the virus spreads very easily in crowded apartments. I think the last time I was on, we spoke about this. I had the virus. I tried to isolate from my family. It's very hard in a Manhattan apartment. My wife got it. We're both doing fine, thank goodness.
Thank goodness.
But I point that out to say it's a big risk. And the city offers a hotel room that wasn't available at the time that I was sick, but that now is available. Almost no one's taking us up on it. You will now, by the way, get a call if you test positive. This wasn't true until early June from a contact tracer. And the first thing they're going to ask you is, are you okay? Do you need medical attention? And then they'll try to understand who else you might have been in close contact with for a sustained period. It's going to be people in your household. If you are out in the workforce, it could be people in your workplace. There could be other social gatherings, etc. They need to trace your contacts and get phone numbers for those people so they can call and check on their status and offer them help and get them tested. This is contact tracing, and it's the way we're going to stop the spread in New York City. And Victoria, not enough people are doing it. Not enough people are answering the call. Not enough people are completing the interview. Not enough people are sharing contacts. And on the back end, not enough people are doing the quarantining and the isolating.
Well, there must be a general fatigue setting in, isn't there? You know,
totally.
I mean, yeah.
Totally. I mean, there's quarantine fatigue. There is distrust of government. There's distrust of anything that feels like enforcement, understandably.
We have flattened the curve, correct? And there was, I think on July 12th, there were no deaths in New York.
Yes. It turned out there were a few reported a couple days out.
Oh, okay.
But we have made incredible progress since the hellish days of March and April, and to some extent May. I mean, we're down 95% from fatalities, hospitalizations, new cases, incredible progress. And especially when you compare us to other parts of the country, the virus is increasing now in 44 states. So we're part of a shrinking group of states, which is more or less stable. But the virus is still circulating in New York City. We are still getting about 350 new cases confirmed every day in the 5 boroughs. So, and there are some early warning signs, particularly with young people, where the number of cases is going up, especially for people in their 20s in New York City, and to some extent less, but some in their 30s. And it's not just getting a positive test, it's also ER visits. So let's remember that while young people, when they get the virus, don't tend to get as sick and thank God die as frequently as older adults, it's still dangerous. And you can still land in the hospital, and there still is a risk, God forbid, of fatality. So everybody has to take this virus seriously, even in New York.
I mean, there was just, I think it was in the governor's press release, or it might have been the mayor's, but they talked about bars that are being fined for, you know, just blatantly disregarding the sort of social distancing rules that are in place.
Look, I understand that everyone is sick of being locked in their apartments. It is so tough not to have social contact with friends and other people. It's hard not to be out there meeting people. I get it. But their safety has to be at the front of everyone's mind. And we need everyone to be conscious about the need to wear a mask, about the need to wash hands, but they need to stay home if you're sick, right? Because you could be, even if you haven't gotten a test, if you're not feeling well, there's a chance you have coronavirus and are contagious. The last thing any of us want is for a massive rebound of COVID-19 in New York City, because that will mean closing what's already open. Nobody wants that. We don't even want to be in that situation of having to make that horrible decision. So to make sure that doesn't happen, we got to keep it tight now. And it's not easy, but it's the only way we can keep the city safe.
I mean, I know that the governor is put the quarantine on New York. Does that protect us? Are people still able to get in here? I know that the airports have signage up and they make you fill out a form, but what about buses? What about trains?
This is not like 50 independent countries with borders you can close. This is a cause for concern. Look, we're also going to have the dozens of colleges in New York City with out-of-state student bodies, and they're all, many of them, most of them are bringing back their students come late August, to the tune of tens of thousands just in Manhattan. And, you know, these are national universities. And so they're going to have young people from every one of the affected states. And I'm worried about that. And it's why, you know, we shouldn't think that we are out of this.
Right.
We shouldn't think that we're done, because there's just too many risks on all sides.
So I want to try to switch to something that's a little more optimistic. That I read today that there was a deal with Pfizer for Americans to get access to 100 million vaccines when there is a vaccine. And then I read about that there possibly will be a vaccine. But then you tweeted out that there are many people that will not feel comfortable taking the vaccine.
We've pinned all our hopes and dreams on getting a vaccine, and there is like unprecedented progress towards establishing an effective and safe vaccine. There's over, I think, 100 efforts around the world. Some of them are really showing great promise, and that's good news. But I think we have to be realistic about what it's going to take to deploy a vaccine to 330 million Americans, really to billions of people globally, because it's a global pandemic.
Right.
That's just going to be an unprecedented financial, logistical challenge to produce vaccines in the billions, but also a real challenge to overcome the skepticism of vaccines, and this vaccine in particular, fear, conspiracy theories, which have been growing for years around vaccines for measles, the MMR. And already anti-vaccine movements are mobilizing specifically against this vaccine. And, you know, I worry that Trump as president also undermines the credibility of the vaccine efforts. The truth is that science is proceeding without being damaged, in the case of vaccine development, by the anti-science mentality of the White House. And at any rate, we're probably talking about deployment in 2021, where, in my opinion, I am desperately hopeful we'll have a different president. But it's time to start now having that conversation with New Yorkers, with Americans, about this vaccine, about the fact that it's going to be tested as safe, about the fact that unless a significant number of people do it, we're all going to be harmed. What you need is what's called herd immunity.
Yeah.
And you only get that probably if you have 70% of people who either have had the disease and recovered, or get immunity via the vaccine. And that's a tall order. And there was a survey done in May nationally that only 49% of Americans answered definitively that they would get the vaccine, while the rest either said they were not sure or no. That's not good enough. And, you know, that's just one survey, but I'll tell you, nationally, we don't even get 50% of adults taking the flu vaccine every year.
Right.
And there's not even a concerted conspiracy movement against the flu vaccine. So in New York, we're a little bit better. It's probably more like 65% on flu vaccine, but still, this is going to be really a challenge. So we need to start now talking to people, addressing their fears, hearing them out. And, you know, there's a bad history of medical care towards communities of color, going back, well, to many incidents like the Tuskegee experiment and many others. Mm-hmm. And so a number of leaders in the Black and brown communities have been speaking out now and saying, hey, we got some mistrust to overcome. And unfortunately, it's well-founded, but the stakes are really high, and we have to start talking to people now, bringing people in for this conversation.
Mark Levine, thank you so much for joining us today.
Thank you, Victoria. And I hope you and the viewers continue to stay safe. You too. Welcome back to
to represent NYC on the Manhattan Neighborhood Network. Joining us now is Leah Goodridge, and she is a supervising attorney with the Mobilization for Justice. She's been with us before, and we're going to talk about the same thing. We're going to talk about rents. And as the deadline approaches, that people can start to get evicted. Is that correct? What is happening?
There is a lot going on. So the stated date for now is August 20th, that there has been an eviction moratorium until that date. We as a legal service provider and as tenant attorneys are getting a lot of calls from tenants who are worried about that. The other issue that's happening is that for cases that were already in court, there are some courthouses that are proceeding with and requiring in-person trials. So if you already had or have a case in court, for example, in Brooklyn and now in Staten Island, and it hasn't settled, you may have to go to court in person to go to trial. If you haven't paid your rent yet and there hasn't been an eviction proceeding that has started, it is possible for a landlord to send you a notice and also to start the case, meaning to start the petition. However, it is a little bit difficult for a landlord to get what's called a judgment against you, and a landlord cannot evict a tenant unless there is a judgment.
Now, I remember that Governor Cuomo allowed people to use their security deposit as rent. Is that still in place?
There have been certain things that have been slashed, like, for example, landlords cannot ask for late fees during the pandemic, because that is a normal remedy that landlords ask for. And in the beginning, there was talk about being able to use the security deposits, but I believe that has been slashed.
Is rent cancellation still a viable argument? Is that something that's still being talked about? Is that something that can happen?
I believe so. There are various coalitions on the ground that are still actively working on pushing Governor Cuomo for it. Now, the main arguments against rent cancellation that we hear have been that it is not legally easy. That's not true. Sometimes some people have argued that it's unconstitutional, but in fact, the governor has the power to supersede any state law and use his emergency powers to do something. So here that would be to cancel rent. Some people argue that it is what's called a private taking, and that's not true also because, again, the governor has emergency powers. People have also argued the same thing about rent stabilization because it, with a private landlord, forces a private landlord to only increase the rent by a little bit as opposed to what he or she would like. And in the same vein, rent cancellation would be a temporary measure and not something that's permanent. So, the argument that it's a taking doesn't really hold a lot of traction because it's not something that would be a permanent measure. It's something that would be temporary. And it's also something that would be for the public good that the governor would be able to do. So it is a viable argument. I think the question is it something that the governor is willing to do? And so far, months have passed by, and there still are active coalitions on the ground and conversations with the governor's office that they have been engaging in. So we'll see.
Yeah, I mean, because the unemployment, the $600 is going to be ending soon, possibly, unless it's extended. I mean, so it's not like we're, in a rebound mode. There are still going to be people that are going to have a very hard time paying the rent.
It's a little bit ironic because a lot of tenants in New York City, specifically Black and brown tenants, have already been in a pandemic before. We have had a homelessness crisis, and the way that homelessness and poverty is talked about and discussed is sort of like, it is what it is. It's something that's been going on for decades. But now that we have a pandemic, there is a little bit of a like, oh my goodness, everyone is affected. So I just want to point that out in terms of the empathy that's being shown, because there are people who were already in a pandemic before the actual pandemic happened. And so now those folks are going to be without a net right? When all of this sort of shakes out, and we don't know how long that will be. But for months down the line, for people who already had trouble finding a job and then the pandemic hit and now we're out of a job, they don't get unemployment. They don't get unemployment.
Right.
So it is, and now may have additional health issues, physical health issues, may have to take care of family members, mental health issues that come along with COVID. All of those issues affect everyone, but they disproportionately affect Black and Brown people. They disproportionately affect low-income tenants who were not able to survive very well during normal times before COVID.
Now, let me ask you a question. If somebody is being harassed because they couldn't pay their rent because either they had COVID, lost their jobs because of COVID, are there any protections in place that are different from, you know, a non-pandemic period, or are they the same, and what are they?
There are. Now, a tenant can bring a court case in court. The court, since the pandemic in March, allowed for what's called emergency court cases. So you can bring an emergency court case, and some of them are for illegal lockouts. Some of them are for what's called HP actions. And a lot of people often think of HP as for repairs, but you can also bring an HP for harassment. So tenants can certainly bring an action in court. We've had them. We've represented tenants doing so at MFJ for harassment. I think when the pandemic happened, you know, there definitely have been some cases we've seen where a landlord has locked someone out because he or she thought that the tenant may have coronavirus.
Wow.
So there's that. And so we're seeing these cases and we are representing them. So you can certainly start an emergency court case in order to prevent harassment.
What would you like to tell anybody who's watching that you think they should know that's going on right now as far as renting their apartment and fears around COVID?
The first thing I tell people is get a lawyer, get a tenant attorney. There was a right to counsel bill that was passed in the last few years, and a lot of people are entitled to an attorney, and you should certainly get one and not handle this on your own. I say that because during stressful times, it's very easy to make a mistake. It's very easy to give into threats. We see a lot of people who, you know, they get a letter or they talk to their landlord and they just move out. You spoke of harassment before. I have seen it where people just move out because they are under stress and they can't deal with it. But if they had a lawyer, that would be a very different result. So the number one thing I would tell people is to make sure to get an attorney. Through the right to counsel, you may be entitled to a free attorney and not have to pay for any legal representation.
Leah Goodridge, thank you so much for joining us today.
Thank you.